Ava Lund-Fouquet is back to full form. Last month, she endured major weight loss and an unquenchable thirst. Classic symptoms pointing to untreated type 1 diabetes.
It's nerve-wracking for sure, and it creates some anxiety.
For good reason. Left untreated, it can lead to ketoacidosis, a dangerous condition children's hospitals are seeing more of.
We have seen more ICU admissions. And the risk, though, of the diabetic ketoacidosis is that there can develop brain swelling and in very rare cases, death.
The increase in type 1 cases in Ottawa over the past year is only anecdotal, but it's being seen elsewhere. This children's diabetes clinic serves all of San Diego County.
We did, in fact, notice to our surprise that there was indeed a much higher rate of type 1 diabetes in kids.
New research from San Diego shows just how high. Compared to previous years, last year saw a 57% increase of new cases of type 1 diabetes. In most cases, the kids tested negative for COVID-19, so the study's author says it's too soon to draw any conclusions.
We really need to see what's happening in the rest of the US, what's happening in Canada, what's happening in other countries, and really see if this trend is consistent.
Like many autoimmune diseases, the causes of type 1 diabetes are unknown. There is often a family history, and illnesses from other infections can sometimes trigger diabetes, but that has yet to be proven with the coronavirus.
Prior to most diagnoses of diabetes, a child will have had an infection, which just kind of tips them over the edge. It doesn't cause them to have diabetes. They would have presented at some point.
If there is shown to be a pandemic link, scientists are hopeful that when COVID-19 cases come down, so too will type 1 diabetes diagnoses. Vic Adopia, CBC News, Toronto.